So here I am again with those wonderful folks at Atrium Neurology, getting my twice-a-year infusion of Ocrevus. For me, it's pretty affordable, a couple $100 every 6 months. That's mainly because I have the benefit of socialized medicine. I'm on Medicare. So while I'm here, I thought I would offer my semi-annual rant against those folks who like the idea of a private, profit-driven healthcare system and love to claim that America has the best healthcare system in the world. We do not. Yes, we have world-class hospitals, Nobel Prize-winning researchers, and some of the most advanced medical technology on the planet. I'm benefiting from some of that today. But for everyday Americans, the system is much harder to navigate, much less celebrate. The United States spends nearly $13,000 per person per year on healthcare, roughly double that of countries like France, Germany, and Japan. And for all that money, what do we get? We rank 48th in life expectancy, dead last among wealthy nations in this world. Our infant mortality is higher than nearly every other developed country. For every 1,000 Americans born here, more than 5 die before their first birthday in America. When it comes to preventable deaths like from heart disease, certain cancers, infections, chronic conditions, and other largely avoidable healthcare problems, better screenings, health behaviors, vaccinations can prevent a lot of those, and we don't do that. Again, far from being the best, our nation as a whole is near the bottom. We're spending more and we're getting less. And not just health outcomes, it's access. Even with the advances of the ACA and Medicaid expansion, nearly 30 million Americans do not have insurance, and millions more are underinsured. 2 out of 5 adults report having to skip or delay medical treatment because of cost. 1 in 4 Americans say they have a family member or themselves who cut pills in half or skip doses to save money. And medical debt is involved in over 60% of personal bankruptcies here in America. The issue isn't our doctors or nurses. Again, they're some of the best on the planet. The problem is a system built around profit-driven insurance companies, unchecked drug prices, and a tangle of regulations and policies that leave millions behind. Now, 200 days into this new administration, the situation looks to get a lot worse before it gets better. The healthcare cuts to Medicaid, the ACA marketplace, research funding cuts, not to mention the changes by Bobby Kennedy Jr., like the elimination of the mRNA treatments, all point to a worse future. If we want a better future, we've got to stop pretending that we've got the best system in the world, when in fact we don't. That means moving away from our current system driven primarily by for-profit companies, led by executives whose job it is to bring in as much premium dollars as possible and pay out as little benefit. That's their job. Moving away from that system won't be easy. It takes some baby steps, like maybe implementing slowly Medicare for all. Big Pharma and health insurance will spend billions of dollars in lobbying to keep the current system in place. Simply recognizing the asinine stupidity of that system is a good start. We've got some work to do.